Well, hello, it's Chris Westfall, and welcome to the 2017 benefit season. I want to make you aware of some updates that are happening for 2017 as it pertains to Medicare and your benefits. First of all, thank you for being a client of mine. Everybody in my office wants to say hello to you, and we just want to let you know that we're really glad that you chose to do business with us here at the Senior Savings Network for your Medicare plan. Now, first of all, in 2017, we have a couple of changes happening with Medicare that you may or may not be aware of. The first of which is Part B, the deductible, which affects everybody on Plan G of Medicare Supplement, Plan D Medicare Supplement, Plan N Medicare Supplement. All of those allow you to pay your own Part B deductible. So let me let you know what that's changing to. In the past, recently, it was $166. Now for 2017, it just came out. It's going to be $183 for 2017. What that means is this: if you're on Plan G, which a lot of my clients are, beginning in January, your deductible with Medicare resets. So this is a deductible with Medicare, not the insurance company. This is Medicare in Washington. They set the deductible. So for the first $183 of benefits for the calendar year of 2017, you will pay that cost at the Medicare discounted rate, but you'll pay the first $183 of outpatient cost because that's what Part B is. Now, last year was $166. This year it's going to be $183 for 2017. If you go into the hospital, that's not under Part B, has nothing to do with Part B. That's going to continue to be paid 100%. So, if you were thinking, well, maybe I should get that plan that doesn't have a deductible. Maybe I should get that Plan F that doesn't have a deductible. That would be incorrect thinking, because Plan F does have the deductible, but you pay extra for the Plan F to pay the deductible for you. So if you can do the math with me, 1 plus 1 is 2. If you have Plan F and the deductible's embedded within it, Plan F's rate increase is going to go up even more to accommodate that new deductible. So if you're on Plan F, you can expect an increase that's going to be at least the increase in the deductible to be meted out over 2017 and the higher rate increases on Plan F. And one of the reasons we like Plan G so much is because you get to pay the deductible and no more. With Plan F, you pay the deductible embedded within the rate plus a service charge to have them pay the deductible from your premium over to Medicare for you. So Plan F is still higher cost, and as 2020 comes around, new people to Medicare can't buy Plan F anymore. So Plan G is a really good value. Plan D in some cases is a good value. That's making a comeback. And Plan N is sometimes a good value, but it's different for every zip code and every age in America. I'm currently licensed in 46 different states. So if you see a video on my channel or anywhere out there that says, this is the best Medicare plan, you've got to have Aetna, Mutual, Cigna, whatever it is, don't listen to it. Even my video, if I talk good about one particular company in one circumstance, that may not fit your zip code and your age and sex and whether you smoke or not. Those are all relative factors that we look at on a case-by-case individual basis depending on where you live. So again, the big news, Part B's deductible is going up from $166 to $183 for 2017, and there will be no benefits paid through Medicare until you meet that $183, and that only talks about outpatient things. So outpatient doctor visits, x-rays outside of the hospital, MRIs. Now, one thing that did come up recently with one of my clients is these hospitals are trying to do this observation status thing, which means that you're not really admitted to the hospital. Even though you could spend 2 or 3 days in the hospital, they're calling it under observation instead of being admitted. If they do that, it's really pulling a shenanigans on the billing system with Medicare so that they get more money. If they do that to you, that's going to be billed under Part B, so don't be surprised. If they keep you in under observation status, that's going to be not fully admitted, it's going to be a Part B cost. So you may have to pay the $183 for that year. But once you pay the $183, remember, once you pay the $183 deductible for 2017, you pay nothing else for Medicare approved charges for the rest of the whole entire year. It's not like you pay it every time. You meet that deductible only once per year with Medicare, not your doctor, not your insurance company. It's with Medicare. Now, a big question we always get is, what happens if you change companies during the year. Well, it doesn't matter. Your deductible's already been met over at Medicare in Washington. So if you change companies and you've already met your deductible, or let's say, like so many of us, we bring people off of Plan F because they're paying too much, and we find a good Plan G or Plan N or Plan D for them, they've already had that deductible paid on their behalf, and they don't have to pay it again. So that's a big part of it. So the other thing that's changing for 2017 is the Part D, the drug plans. Plans either have a deductible or they don't. That's their choice when they build the plans. If they do have a deductible, that's being increased for 2017 to $400. Now, personally, I like the plans that don't have a deductible, and you can ask me about that. Be happy to tell you about that in specifics there. But anyway, I want to let you know that Medicare Advantage plans are still losing their networks in a lot of cases. A lot of them are going out of certain marketing areas. If you know a friend or a family member that's losing their Medicare Advantage plan, we may be able to help them because that gives them a special period in which we can rescue them and put them on a good Medicare Supplement plan. If you know anybody that's being affected by that with those Medicare Advantage plans, you know, they often get let in with those zero premiums. Then they actually use it and they find out that their maximum out of pocket is not zero, it's $6,700 in many cases, in most cases. So if you know somebody that's been on one of those plans and wants to get off, they've got to do that before January 1, and again, we can help walk them through that process. There are a lot of mergers and acquisitions being talked about and being pushed through right now. I want you to know that as I lead a training site that trains over 2,500 agents, it is my responsibility and what I do all day working on the business, which is keeping up with what's happening in our industry. So if you're with an insurance company that's going to be affected in a very adverse way, you're going to get a big rate increase, we're going to reach out from my office and try to pull you out of that plan. Now, sometimes you can change, sometimes you can't. Sometimes it depends on your health, but we'll keep on top of that for you. And if there's ever a time that you're not comfortable with the rate increase that you're getting, please call us. We can't see your rate increase in some cases, and if we do, we can only see it 45 days before it goes into effect. So many times during the annual election period, our clients will see these television ads and newspaper ads and all over the billboard saying, now's the time to change your Medicare plan. That's talking about your drug plan and has nothing to do with your Medicare supplement. Your Medicare supplement is guaranteed renewable and guaranteed for life. As long as you continue to pay those premiums, no one can take that plan away from you, and that's very important to remember. Your benefits cannot change. That's a contract that lasts for life. So no matter what happens to Medicare, your plan that you bought when you bought it cannot change. Even the folks that bought Plan J 10 years ago can keep Plan J. Now, we can probably find them a lot better plans out there now, better price than the old plans, but the plan that you have, no one can change. So during the annual election period, October through December 7th, you don't have to do anything. If you want us to look at your rate, we can, but your rate can only be changed by the insurance company once per year, and that's on your policy anniversary date. When you buy a plan, it locks it in for 12 months past your start date. So there's really nothing to do there. But as always, if you want to shop your plan again, just to look at the market, because we do get new carriers from time to time, we're happy to do that for you. And if you know anybody who's been on Medicare for, let's say, 5 years, somebody needs to be shopping their plan. Just looking at the rates, just to make sure that they're not getting hammered with rate increases when there might be something much more affordable. And in some cases in here, it's incredible. We save people $100, $150 per month. And for a couple, that's significant savings just because we're looking at their Medicare plan and shopping it. So thank you again for letting us help you with your Medicare plan. And if you know anybody else that does not have a personal relationship with an agent, please shoot them our way or send me an email, let us know. We can reach out to that person and see, based on your recommendation, if shopping their plan might be the best thing for them to do. And certainly, if you know somebody turning 65 and they're getting that stack of mail on their table, which happens all the time, please let that person know they don't have to do that alone. We're here to help them with that. You know, one thing that really bugs me right now, what's happening with the Affordable Care Act leftover, is this thing called seamless conversion. Seamless conversion is if you're 64 years old and you are with any of the big insurance companies, because they're all doing it right now, and you had an Obamacare plan, an Affordable Care Act plan, they're actually allowed to roll you into their Medicare Advantage plan, whichever plan they want to. They can just roll you into a Medicare Advantage plan as you turn 65. Now you're eligible for Medicare, and you don't even know it. That's really, really bad in my opinion, my personal opinion. So the problem is this: they'll send you a letter saying, hey, you're being switched from your old insurance company plan under the Affordable Care Act to our new insurance plan with the Medicare Advantage, and here's your network, and here's your assigned primary care doctor. But the problem is this: when you're 65 years old, you got a stack of mail this high. How are you going to notice that one of these things is a real notice to you and not an advertisement for come join our Medicare plan? That's a big problem. So if you know anybody turning 65, let us walk them through the process so that they don't get slammed. You know, in the old days with long distance companies, you may remember this, they used to slam people, which means they just automatically move them to another long distance company. And finally, the Federal Communications Commission said, that's illegal, you can't slam people anymore. And yet, they're allowing this to happen to seniors right now, turning 65. Under seamless conversion, they're moving them into a Medicare Advantage plan without asking, without their permission, and without adequate notice, because it's just a paper lost in the shuffle of a big desk of paper. Anyway, as you can tell, I'm kind of passionate about making sure our seniors are getting the best deal, not getting hammered by insurance companies, and that's what we're here for. So if there's ever anything you have a question on about your policy, about changes in Medicare, which we're staying up on every single day, I assure you, please give us a call. That's what we're here for. My staff is growing and growing and growing so that we can accommodate the additional clients that we're bringing on. So when you call my office, even if you're not speaking directly with me, you've got one of my hand-trained, picked people that are sitting right next to me in the office that know everything about Medicare that I know. I make certain of it. Thank you so much for your loyalty. Thanks for being a client. And please don't suffer in silence. If there's anything going on with Medicare with you, don't handle it alone. That's what I'm here for as your agent. Thank you, God bless you, and I hope you have a very safe, prosperous, and healthy 2017. Bye-bye.